Okay, good afternoon, everyone. I make it 4 o'clock, so we'll go to start. I just wanted to welcome everyone to the annual members meeting and Council of Governors meeting for today, Tuesday, the 4th of October. Also, just before we start, just to go through some welcome and introductions. I'm not aware of any declarations of interest. I'd also like to welcome everyone present. That includes governors, members, guests, executives and non-executive directors, presenters and any other staff. I'd also like to extend our thanks from MPFT to those who are now stepping down as governors. We've appreciated your commitment to the role and your valuable contributions, and that goes for Lillian Owens, Paul Lithgow, Rajesh Sulek and Karen Nixon, so thank you. Also, I want to welcome today, we've got 7 new, some returning governors. So my thanks to and welcome to Lynn Fowler, Becky White, Simon Mountford, Ravi Bakri, Leslie Roberts, Jane Greening and Sarah Marie Bailey, who's been re-elected. Okay, and just for some caretaking, just to sort of ask if people can raise their hands if they have any questions. And again, to keep videos and microphones muted unless you're invited to speak or present. And also just to ask people to present themselves and where they're from if they are speaking. As this is a governor meeting, I'd like to invite governors to ask questions or make comments after each agenda item. But due to time constraints, we may only be able to have about 2 questions per item, but we'll look at how the time flows. And also, lastly, I'd just like to highlight this meeting's being recorded, and so participation in this meeting is taken as consent that you're happy for the recording to be done. But also, I just wanted to highlight, we haven't put a comfort break in on the agenda. However, if people do need to have a comfort break, stretch their legs, make a drink, please feel free to do so. It's quite a tight agenda today, so my apologies around that. Okay. Just moving on in terms of apologies for absence, I've got Richard Cottrell, who I'm chairing on behalf of Richard, and sorry I haven't introduced myself. I'm Jackie Small, non-executive director and vice chair, and I'm chairing in Richard's absence. But also there's an apology from Nicholas Sherwood, Becky White, and I believe Lynn Fowler, you're now here. You were initially an apology, so welcome. And just before we start into the administration, I wanted to for us to showcase a short video that's highlighting the awards that MPFT has been successful in winning over the last 12 years. So a video that will be shown now. Thank you.
It's been another hugely successful year for MPFT, and we are so proud of the number of awards and recognitions presented to us. These awards are testimony to all the incredible work that is happening across the Trust to achieve our mission of making life better for the communities that we serve. Information Management and Technology team won the Future NHS Award at the NHS Parliamentary Awards. The team was recognised for improvements in reaching the digitally excluded in their homes. Success for MPFT researchers at the National Institute for Health Research Clinical Network Awards. Pioneering healthcare research from MPFT and its academic partner Keele University was commended with 3 award wins at the Regional Awards Ceremony: Collaboration and Research Award, Improvement Project of the Year Award and Team of the Year Award. Cavil Star Award win for Children and Families Nurses. Chrissy Leighton-Bennett and Laura Merchant were recognised for their commitment and dedication in going above and beyond for colleagues. MPFT Nurse is an NHS England Safeguarding Star. Safeguarding nurse Amanda Atherton was presented with an NHS England Safeguarding Star Award for her work in promoting safeguarding messaging across the integrated care system. Information Management and Technology achieved a double win at the Digital Leaders 100 Awards. The team were announced as the overall winners of the 2022 Digital Leaders, as well as winning Digital Skills Initiative of the Year. The win was for the rollout of the tablet devices to support community nursing staff access patient records with no internet connection. Community Mental Health's triage team received Staffordshire Police commendation. MPFT's West Community Mental Health Triage Team's partnership with Staffordshire Police has been recognised with an award. MPFT wins NHS Procurement Transformation Award. A pioneering new partnership offering digital emotional health and well-being support to children and young people experiencing anxiety, depression and other mental health issues has won the prestigious NHS Procurement Transformation at the NHS in the Midlands Excellence in Supply Awards. Allied Health Professional Support Worker awarded the Outstanding Achievements Higher Apprentice Award. Emma Busby was presented the award at Newcastle College's Celebration Awards for putting herself forward for new opportunities and challenging herself with internal training, meetings and successfully gaining a promotion. MPFT retained UNICEF UK Baby Friendly Initiative Gold Award. A highly prestigious accreditation was awarded to MPFT's health visiting and school nursing for the second time, in recognition of the support provided to parents and babies in Staffordshire and Stoke-on-Trent. Global success for MPFT General Manager. Sharish Pakenham was selected for a Global Health Leadership Scholarship with the Florence Nightingale Foundation. MPFT received recognition for the development and support of apprentices from Newcastle and Stafford College Group. Claire French and Caroline Green were presented the Outstanding Contribution to the Development and Support of Apprentices Award on behalf of the Trust. Staffordshire Community Dental Services were shortlisted for the HSJ Patient Safety Award. The team were shortlisted in the Improving Care for Children and Young People Initiative of the Year category for their positive impact on both staff and patients. IT Trainer was nominated for 2 Women in Tech Excellence Awards. Lucy Roberts has been nominated for the Rising Star of the Year Award and Woman of the Year Award for her work on many digital projects, including Rio Mobilisation and Rio Workflow. Mental health practitioner recognised as a positive LGBT role model at the National Diversity Awards 2022. Hannah Spencer has been nominated for the personal and professional experience they bring to promote and influence change towards genuine LGBT+ belonging, particularly in the context of occupational therapy in the UK. Chief Executive Neil Carr received an honorary doctorate from Keele University. Neil was awarded the Honorary Doctor of Science degree in recognition of his outstanding contribution to the development of education and research within mental health and community care.
Thank you. I'm sure you'll all, like myself, congratulate all the teams and services involved. Some real achievements that have been made. That's excellent. I can't see any further hands up. So now I'm just going to go into the administrative part of the meeting. So all of you should have minutes of the annual members meeting from September 21 and the Council of Governors meeting from May 22. So again, it's to approve those minutes. I'm not aware of any comments or changes around those. So is everyone happy to approve those? Okay, can't see any hands up or anything. Okay, brilliant. And I'm not aware of any matters arising either around that. Okay. So now we've got the External Auditors Report, and I just want to introduce Tony Feldhaus from KPMG, who will be taking us through a summary of that report today. So welcome, Tony.
Thank you, Chair. Just check everybody can hear me okay?
Thank you.
Yeah, perfect. No, thank you. Yes, I'm in out to another client in a slightly echoey room, so apologies if there's a bit of echo on the line. So yeah, just take you through the document. So as I say, I'm Tony Feldhaus, Senior Manager on the External Audit of MPFT, and the document you have in front of you today is our Auditor's Annual Report for year. We completed auditing back in May, June time. It's a public document that's already been obviously issued and final to the trust and been through the trust audit committee, etc. So as I say, it provides a good and hopefully concise summary of the audit work that we undertook on the year ended year ended March 2022. So if I can turn to page 3, there provides in the table on the right hand side provides a quick summary of the elements of the audit. So our financial statements audit, importantly, was a clean and a true and fair opinion on the trust's accounts. As we said in the top box there, we signed off on the 20th of June, which was ahead of the deadline, and not all trusts managed to deliver their accounts to that deadline. So that's a great compliment to the team at the trust to support the process in helping us deliver that. The second box down talks about the annual report, which is sort of the front end of the financial statements. Obviously our work focuses on the numbers, but clearly there's a very important part of the accounts at the front, which is the narrative piece, which is the annual report. And one of our key things we check on the audit is that narrative element isn't inconsistent with the rest of the accounts and anything we know about the trust. And as I say, the comment says there we didn't identify any significant inconsistencies, and also that the annual report was prepared in accordance with the relevant DHSC requirements. The third point there is on value for money, and an important part of our work is to provide an opinion on the value for money in terms of the trust's operations and activities. Later in the report, we've provided a bit more narrative around the various elements of value for money. And I think the most important thing is, again, that's a clean opinion. We didn't identify any, whilst there was a significant risk that we identified in terms of financial sustainability at the trust, which is a common one across the sector, and pretty much all of our clients, we identified that as a risk. But when we did the further work at the final audit, we felt that the trust arrangements in place were adequate and effective, and we didn't identify a weakness in the arrangements to secure value for money. So that's a clean outcome in terms of that particular area. And then the final point, really, other reporting is around any other reports we're required to make in our role as auditors in relation to the trust's activities. And we're pleased to know there weren't any other reports, there weren't any breaches of any other regulations that we identified through the audit that required a report in that regard. And then the rest of the document, so page 4 really just summarises purely on the financial statements element of the work, so not the value for money. This focuses on the accounts audit, and that just sets out the significant risk areas that we identified in our audit plan and our response and findings to those significant risks. And you'll see there from the summary, we didn't have any material misstatements identified through the work or any recommendations. So overall, a good outcome there for the trust. And those risks aren't, specific risks for MPFT as an organisation. They are risks that we identify typically across a number of our trust clients. So again, that's overall a good outcome for the audit on that. And then the rest of the document, which I wasn't going to go through in a lot of detail, provide a bit more of a narrative, as I've mentioned before, around value for money. And we are required to put a little bit more detail now in our annual report around value for money, in line with the requirements on us as auditors. And this is, say, part of a public document that goes on the trust website around the value for money and arrangements in place. So hopefully you'll be familiar with a lot of the content of that. And as I say, it is a report at a point in time, and again we'll look at it as part of our audits going forward. But overall, no adverse conclusion around the value for money element of our work. So perhaps pause there, and happy to take any questions on any of the document.
Thank you, Tony. Are there any questions or comments for Tony? Okay, I've got one hand up. Nicholas, hi.
Hello there. Do you cover the pension as regards, is the pension very viable at the moment.
Is that is this the LGPS
Well, we have a
pension?
number of people just about to have their pension. Is their pension quite viable at the moment? As regards, we are reading in the papers that pensions have got problems.
Yeah, well, I mean, essentially, pension. You're right. I mean, pensions, as part of our audit, we do look at the assumptions around the local government pension scheme valuation. So, I think in the trust accounts, there's I think it's a pension asset, I think, of about £3 million. So we do look at the underlying assumptions at a point in time, and clearly, it's quite, as you're right, it's quite a volatile area, and then no doubt things will move on again during the current year with certainly the current hike in inflation is certainly having quite a big impact on pension valuation. So no doubt when we look again next year, it's going to be more turbulent. So it is a challenge. It's part of the audit. It's not in terms of that value that's on the trust balance sheet. It's below our audit materiality, but it is big enough for us to warrant looking at it. So we do look at it as part of our work.
So it is looked at. Right, thank you.
I can't see any further hands up. So just wanted to thank you, Tony, for... Oh, I've got another hand. Chris Sands got his hand up. Hi, Chris.
Hiya. Just in relation to that question, the vast majority of staff come under the NHS pension scheme, which is a government-backed scheme. Yeah. So those that relate to the local government scheme are very small in terms of numbers. So quite an immaterial number from an accounts perspective. So although there's been quite a lot in the media around the impact on pensions, that's predominantly around private pensions, not the NHS pension, which is government backed.
Yeah.
Thank you. Thanks for the clarity. Thank you. Okay. So thank you, Tony. Thanks for taking us through the annual accounts. Okay. So the next item I have on the agenda is just an introduction to our two new non-executive directors. So it's Pauline and Simon. Welcome. And Pauline, can I ask you to provide us with an update, just a bit of background about you?
Certainly. Thank you very much, Jackie. So first of all, I'd like to just start with a thank you for inviting me to be non-exec director. I do feel genuinely proud to be joining the MPFT family. I thought I would take the approach of the looking back and looking forward. And so if I look back, then I do join you as an experienced non-exec director from an acute hospital background. And I've held executive director roles focused mainly on people, culture and change. And I currently work with executive boards privately on culture change and behaviour. So if I look back over my 12 weeks in the trust so far, so I have completed our local induction programme. I've had one-to-ones with all of the executive and actually with some of yourselves, and I look forward to arranging more as the future comes. I've undertaken some on-site visits, chaired the people committee, been a member of the quality governance committee and the digital committee. I have attended the NHS providers induction programme, and I've also attended Shropshire Telford and Wrekin Integrated Care Board. I've undertaken my Mental Health Act training and also some hospital managers training. As I look forwards, I've got some quality standard assurance visits coming up, and I'm sure I will meet some of you as we undertake those. And I've got some visits planned during October and November with the Shropshire, Telford and Wrekin Care Group. Looking forward to continuing to chair the People Committee. And for me, the things I'm really passionate about are truly collaborating. And as we collaborate with the ICS, how do we really hold on to the great parts of our culture? And I think that's an important thing as we look forward, and having that voice at the ICB in that regard. And particularly personally, health and well-being for our staff, because they are the jewels in our crown, and they absolutely reflect on all the care that our service users receive. And finally, personally, I'm passionate about end-of-life care. So if there's any small little thing I can do that really improves somebody's end-of-life experience, that would make a big difference to me. That's all I'd like to share with you. I'm happy to take any questions.
Thank you, Pauline. Good to have you on board. Thank you. Any questions or comments for Pauline? Can't see any hands up, so welcome. Okay, can I ask Simon to just provide us with a brief update and welcome to the Trust?
Thank you, Jackie, and good afternoon all. You all hear me. Like Pauline, I'm very new. In fact, I'm newer still than Pauline. I've only just completed a month at the Trust. I was appointed with effect from the 1st of September. I come to the Trust having recently retired from the Financial Conduct Authority, the financial regulator, where I was for 10 years. I was company secretary and director of corporate governance there. And so I come to the Trust with a background in financial management and governance in a whole range of both public, sort of quasi-governmental organisations, but also profit-driven organisations as well in the private sector. I'm a chartered accountant by background, and that's and for me, obviously, I'm then coming into, as well as being non-exec director, also chair of the audit committee, which I'm very much looking forward to. And I'm also a member of one or two of the other committees, particularly the financial sort of aspect, if you like, so finance and performance, for example, and major transactions. I'm, like Pauline, starting to just soak up as much as I possibly can about the Trust. I'm meeting people, although most of those meetings are still by Teams, but I'm very much looking forward to getting out and actually meeting people face to face. And so as soon as I can get these into my diaries and other people's diaries, I'm looking forward to getting out to visit sites and, of course, meeting those of you as governors as well. And I'm sure those opportunities will come over the weeks and months to come. My initial impression of the Trust has just been to be hugely impressed, both by the sheer breadth of services that it provides. When I first became interested in the Trust and started to sort of pursue my application to be a director, I was just sort of bowled over by the geographical footprint. Obviously, just Shropshire and Staffordshire is a large place anyway, but obviously we go much further beyond that. But also the sheer range of services that we provide within that. And what's already become very clear to me is just the sheer quality of the staff. The executive and leadership teams are hugely impressive, but also just through everything that you read about the Trust, everything you see about it, and we saw a little bit earlier in the introductory video, of just the sheer attitude to patient care and just putting that right at the front of what we do. And for me, that's hugely exciting. I spent most of my career in London. I sort of lived in London for nearly 40 years. But last year, as I approached retirement, moved to Staffordshire. So I now live in the middle of the constituency, as it were, which again, I think is really, I'm really pleased about that. And obviously, I therefore have a real sort of personal interest in the success of the Trust. And for me, also, although I lived in London for so long, I was actually born in Stoke-on-Trent anyway. So I'm a Staffordshire boy by background. So I'm delighted to be involved again in an organisation like this. So that's me.
Great, lovely, thank you. It's great to hear from you as well, Simon. Just wanted to welcome both you and Pauline to the Trust, and it's really good to have you on board. I just wondered if members or governors have any questions that they want to ask or any comments at all. Okay, so no hands up. Okay, so thank you. The next part of the agenda, and Pauline's kind of introduced us to that, is the looking back and forward in terms of the past year and what we'll be doing in terms of looking at the sort of future. There's a short section where you'll hear perspectives from myself, from Neil and Fiona, and I'll go first if you like, and just sort of like highlight for me looking back and looking forward. So I suppose more recently, I've been appointed as the vice chair following Megan Nurse moving to the ICB for Staffordshire Stoke-on-Trent, and I just want to also thank her for the work that she's done at past service. But also I want to just highlight that I'm really proud to be made the vice chair, and I'm also delighted that I've continued in the role as the chair of the Quality Governance Committee, an area that's really close to me. And again, I would want to just highlight, looking back in terms of the committee, the Quality Governance Committee, over the last year, how we've strengthened ourselves and enhanced how we focused is we've recently revised the agenda to align much more closely with the Trust Assurance Plan, and that enhanced focus on risk appetite. So again, we've, as a governance group, we've actually focused on risk P10, which is around increased demand for CAMHS services. So we've made that our strategic priority for the year going forward, and really looking at how we can ensure that our services are safe, effective and well led to actually kind of manage that increased demand for CAMHS services. Again, I'd just like to highlight on a separate note, I'm sure that many of you here will be aware of the recent restricted practices and seclusion the headlines that we've had in the media. And I just wanted to provide some assurance from a quality governance perspective that as a quality governance committee over the last year, we've been receiving regular updates, quarterly and annual reports. And again, the reports detail the types of restrictive practices and details in relation to patients who the restrictive interventions have been applied to, and we can actually see that by protected characteristics as well, which provides some assurance. And again, I think as part of the reporting of the Quality Governance Committee, we also receive updates on the progress on the implementation of safe wards as well. So we know that there's a number of modules, and we know by ward what modules they've actually completed. So again, that gives us some assurance around our approach to restrictive practices and seclusion. And again, I think one of the important things around the approach we've taken is that we've also followed up as a committee with the Trust Ethics Group, and the terms of reference of the ethics group has been updated so that we now have highlighted that we would consult with external experts and any collaboratives on restrictive interventions as an assurance to ensure that we get things right. And so just to kind of highlight those points, but I also wanted to mention something about my role. I am now the Senior Independent Director, and I just wanted to highlight what that actually means from a non-executive director perspective. And again, it's about me being the key contact externally if there are any concerns regarding the performance of the chair and other board members. Also, I work closely with the chairman in terms of leading the board of directors and acting as a sounding board and source of advice for the chairman. So we have regular conversations. It's about also working closely with the lead governor. And so in terms of looking in the future around appraisals of the chairman and being available to governors as a source of advice when the chairman can't be present. So those are just some of the actual key responsibilities of a senior independent director. Again, over the last year, I wanted to reflect on my role as a NED. I'm the sponsor for the Race, Equality and Cultural Heritage Staff Equality Network. And again, as part of that role within the network, I've had a role in terms of listening to some of the concerns raised by that staff group, but also responding to the concerns, such as some of the examples would be around the COVID vaccination programme, where there were conversations about hesitancy for particular staff groups, actually ensuring that I raised the profile of that and actually got the relevant people to be able to talk to and assure that staff group and provide them with information. And also I've been involved in work where the Reach Network wanted to be much more involved with consultation around trust policies, and that has started to take place where the group quite often will have someone come to listen to some of their feedback on key strategies and policies. Also, again, with the concerns raised through the Reach Network, I'm a member of the People Committee, so share that information in the form of a report and look at ways in which some of the issues can be resolved and actions taken forward. Just moving on as well, as key part of my role, like the other non-exec directors, I've participated in a number of virtual and more recently face-to-face quality standard assurance visits and visits to clinical services, and quite a numerous number of services in terms of Ashley House, Home First Stafford, Ellesmere House, the Staffordshire Prison Cluster, the Southwest Community Intervention Service, but also diabetic retinopathy and other services. And I think for me, one of the things that's been really, really enlightening about those visits is I'm struck by the passion, motivation and commitment of our staff and teams in terms of they work hard to make sure that the services are safe, effectively and well led. But I also think during the actual process where COVID infection rates were high, going that extra mile to ensure that some of our patients are actually connected better to their families and able to do virtual visiting and a whole raft of things. So really positive there. I'd also, looking back, like to highlight the Trust's contribution to the COVID vaccination programme, and that's been led by our research team, who've been helping clearly to save lives. And this has been evident in the research and innovation reports that we receive on a quarterly and annual basis to the Quality Governance Committee. And again, I'd also like to commend the work of the clinical and practice networks, which were relaunched earlier this year. And I think that they've been a real enabler by which clinicians and practitioners contribute to some of our improvement initiatives. And lastly, but not least, in terms of looking back, I've been touched by the service user stories to the board, which have had a consistent theme about the impact the fragmentation of services can have on individuals and their families. And what kind of gives me some kind of confidence is quite often our managing directors will take some of those issues and look at how we can prevent those problems happening for future families, service users as well. Okay, and just 3 points about looking forward. I just want to highlight that looking forward, I'm keen that we continue as a trust to deliver our ever improving quality of services, and that we listen to feedback from the people who use our services and those who work in them, and carry on applying our tried and tested quality improvement methodology. And also, I think what another important point is Midlands Partnership Foundation Trust, as an integrated provider of health and care, is central to the integrated care systems that we're currently working within. But it's also about delivering that joined up, wrapped up around individuals and their families, which will improve quality and reduce duplication. And lastly, I'd just like to say that for MPFT, I think it's really important that it is seen still as a fantastic place to work within, but also that we focus on supporting and growing our staff, building on the Trust's health and wellbeing strategy, and looking at innovative ways of working and apprenticeship schemes as well. So broadly, that was me looking forward, looking back and looking forward. So thank you. I can see a hand up. Hi.
Jacqueline, thank you very much. It's Councillor Anne Edgley speaking. I'm the partner governor from the county. I'd just like to take you back to what you were saying about CAMS. Where are we at with waiting times on CAMS? Are they good now, or we still got a lot of people, children waiting for treatment, or what is the situation at the moment, please? Thank you.
Okay. I wonder if I can ask one of my exec colleagues to actually come in. Thank you.
If I might come in, Jackie. Thank you, Councillor Edgley. Compared to where they were 6 months ago, they are improved. However, we are seeing more and more young children being referred to services. I was astounded to learn only last week that we're receiving about 120 new referrals to CAMS in the Shropshire area alone. It's not as significant as that in Staffordshire, but there is a significant increase, and the huge progress we've made over the last couple of months has gone back, not dramatically, but nevertheless, waiting lists have become a little longer. One of the things the teams are doing at the moment is prioritising young people and families based on risk. So I want to stress to governors, wherever you enter the waiting list, you don't wait for your name to come to the top. There is a risk assessment that involves general practitioners, schools, etc., to determine how a child is seen. And as I'm doing that, Jackie, I see the Managing Director for Children and Families has just cropped up. So I'm really going to abdicate to a real expert now.
Thank you.
Thank you.
Thank you, Neil, and I support everything that you've just outlined. The team have made tremendous efforts and tremendous progress in terms of CAMS. So we've been able to reduce the waiting times, not only for those initial assessments, but the ongoing support that young people need. There is still a long way to go, but it feels like the leadership, the enablers and the culture has really moved on. And we will be in a position to see that risk, certainly in Staffordshire, and starting to reduce from a 16 over the next few months if the progress continues as it currently is. And that's for the South Staffordshire footprint.
Thank you. Thanks, Claire. Neil, do you want to come back in? You've got your hand up again.
Thanks, Jackie. As we're on the subject, and I know Councillor Edgley is intimate with these issues, it is a partnership between ourselves, schools, primary care, etc. But I think most governors, members of the trust would acknowledge child and adolescent mental health services has got to be in a strap-cashed environment, has got to be one of our absolute priorities over the next period of time. Stating the obvious, unless we get it right for children and young people, they will become the casualties of our adult services.
Thank you for that. I agree. Couldn't agree with you more. Early intervention. Thank you.
Thank you. Thank you both. Okay. Are there any further comments or questions? I can't see any hands up. So Neil, can I invite you to take us in terms of looking back and looking forward?
You can indeed, Jackie, and I was very impressed with what you did. So as you were talking, I was scribbling out some of my issues. But a very good afternoon to you all. And can I thank governors? Can I thank members for being close to the organisation? Because along with our service users, carers, patients and staff, you are the lifeblood of the organisation. You're people that can help to challenge us the way we do things. We can take counsel from you. And I know a number of you have supported some of our forums and events. So thank you. If as Chief Executive, I was asked to use a couple of words to describe the trust over the last 12 months, I would have to say I'm humbled and I'm amazed. Genuinely, people like me are supposed to say very positive things in events like this. But can I be absolutely clear? Whether it be our social care staff, our health staff, physical, mental health, they have all gone extra miles and they have all been supported by our corporate services, whether that be finance, workforce, etc. In my 47 years of working in the NHS, I have never known it as precious as it is now. And I anticipate this winter, the pressure will continue to grow. We're expecting to see significant issues from the flu. And I think we're already beginning to see the effects of the COVID-19. So a cheap plug, if I may, when you're offered your second booster, please do take it and as quickly as possible. But humbled and amazed. You know, I've said I've been around the NHS a long time and some would say, yeah, too long. But I was off at the beginning of this year and I had 3 months off following heart surgery. Not all of that time was spent in hospital, but some of it was. Some of it was being investigated, the surgery, and then the recovery from the surgery. So then that happened mid-September and I came back to work in January. It was the care I received. It was the communication I received from all staff that reassured me I was going to make it. It was the opportunity to be involved in rehabilitation and to have someone explain to me what that means. I'm not labouring the points about me and my physical woes. But what I am saying is I have learned a lot and I've been able to take my experiences as I've gone round wards and departments inside this organisation. And I've found staff who are expert in communicating, putting patients at their ease, delivering difficult messages sensitively. And that to me is the essence of what our organisation is about when it comes to living its values, when it comes to displaying its behaviours, etc. It's been a huge year in terms of re-establishing services, and you've heard some of that around child and adolescent mental health services, but also a range of other services. We've had to become, and we are, a very effective partner to the acute trusts, whether that be University Hospitals Derby, Queen's Hospital Burton, University Hospital North Staffordshire, or County Hospital here in Stafford, because they have been under significant pressure with acutely ill patients. And through our physical healthcare services, we've had to develop new ways of signposting patients away from accident and emergency hospitals, our CRIS services, etc. We've had to work in a different way with general practitioners to manage people through our district nursing teams far more effectively in the community. We've had to work hand in glove with our colleagues in social care, both Staffordshire County Council and the City of Stoke Council, when it comes to working with care homes and ensuring patients, service users move on to the appropriate places. Those services have all improved significantly. And that's been despite some of the significant issues around care homes and care in the community. But it doesn't stop there in terms of physical health care. Some of our specialist mental health services during this last year down in the south of England, Howard King and his team were able to open an inpatient detox unit for people recovering from alcohol substance misuse. Tremendous achievement. Very recently, we've just opened one of only 5. I believe we're the second in the country to open. There are 3 more to follow us for gambling addiction services, and that service is in Cobridge up in Stoke. Our mental health services have never been bed-based. We've been one of the trusts that really has exercised our right to develop services in the community. But to develop services in the community, that can only happen through social care, in harmony with housing, working in partnership with voluntary organisations, etc. And we continue the journey of developing community-based mental health services. So only the most severely ill will find their way into hospital. Jackie's already made reference to that horrific programme, Panorama, and what face value I believed was the systematic abuse of patients. Would I ever be foolish enough to say it could never happen in a service that I have the privilege of leading? No, I wouldn't. Would I say we have sophisticated governance that allows us to continue to monitor? Yes, we do. But for all of the sophisticated governance we have, the issue for me truly is the behaviour of our staff, the attitude of our staff. And there does come a point where we would need a member of staff who saw something they didn't own or they didn't understand to blow the whistle and say, is this right? And that's where I truly feel confident that what the senior leaders in the organisation have done, they've instilled that confidence into staff that they could blow the whistle, or in confidence, they could go and talk to somebody else about what's happening. And that's what gives me the confidence. The staff would do the right thing. The board did discuss the Panorama programme last week, and a full paper will be taken by the Chief Nursing Officer to the board at its October meeting. So there is much happening. But where I want to commend my executive colleagues, my managing director colleagues, and senior manager colleagues is for ensuring people do the right things at the right time, that we are following an evidence-based approach. The amount of awards we've won for challenging the status quo, for researching, whether that be in rheumatology or whether that be in psychoses, it's finding new ways of working. But once you've found new ways of working, you have to equip staff with the right skills to operate in that way. That's a challenge for all of my executive colleagues who have a clinical background, whether it be the medical director, finding the right quality and numbers of consultant medical practitioners, and the trust employs over 150 medical practitioners now. And between the teams that they are part of, we see hundreds and thousands of patients each year. And on the whole, those individuals give us a very positive review. So do I believe our quality of care is high? Yes, I do. Do I believe the issues that Panorama highlighted would be never events in this organisation? Yes, I'm bold, but because of what I've told you, and that is I truly believe staff would do the right things at the right time. If I was to mention every staff I would want to recognise for their huge contribution, this meeting would go on till at least this time tomorrow. And I'm going to resist that because I will offend somebody by not mentioning them. However, I do want to pay tribute to the work that Steve Grange and his team have been doing around health inequalities, population health management. You know, people like me go through the rigor of the NHS changing its shape every few years, new policies, new procedures, new ways of working. But working in partnership with local authorities, we're now, I think, at the point of something very special, which is about saying locality on locality, political ward on political ward, one size does not fit all. So as we move forward, colleagues, into the future, the data, the rich data we will collect will help us to determine how we should be prioritising our resources, whether they be social care, healthcare, or how we will work with the voluntary sector. And I hope I've said it enough for you to have a real sense that I'm not just being tokenistic. It's no longer just about health. Health will play a part, but on someone's journey to wellness, that's not likely to be the major issue. It's that real partnership. Does someone have decent housing? Have they got access to decent education? If they want leisure facilities, is that available, etc. And I think there are some real issues there that over the next year we will need to develop as we move forward to sensitize the way we use our data to make sure we provide the right services to the right people. I think, however, new ways of working are inevitable. We'll have to change. We are seeing more and more complex clinical and social presentations. And that will necessitate us to have a different type of workforce to the workforce we have now. I'm sure every time you turn the television on, you hear that the health and social care services are not necessarily attractive places to work, that staff are leaving early, taking early retirement. Historically, staff that retired might come back and do part-time work. They find it very stressful now. They perhaps don't want to take on those additional responsibilities. So my colleagues in workforce, Alex Brett and her team, have the unenviable task of finding ways of engaging with those staff, both before they retire and to request them to come back and do some work with us. The way we work now is not the way we will work into the future. And through our training efforts with the universities we work with, but also through the Trust's internal training processes, we will have to equip a workforce fit for purpose. And you know, if we're modernising, if we're challenging, if we're transforming services, we do not have years to achieve that. We have a very short space of time. And my sense would be, we have to be in a very different place to where we are now. I'm not proud of the fact that at the moment, and Alex may correct me, we've got 700 and odd vacancies in this organisation. Now, we employ 10,000 staff. So let's put it into a context. But if some of those staff retire in the next 6 to 12 months and take their huge experience with them, you can imagine our job becomes more and more complicated as we're dealing with more and more complexity. And I think that's the point I want to make. Jackie, I need to end now. So can I take the opportunity to say, you've heard from a NED's perspective. We've changed the guard. We've got new non-executive directors on board, and I'm delighted. But I would want to pay tribute to two of my colleagues from an executive perspective who left very recently. Jane DeVille left as Director of Finance and Deputy Chief Executive. I think it's when she heard I was coming back, to be honest with you. But I continue to be good friends with Jane. But I'm delighted we were able to appoint Chris Stans as our new Chief Financial Officer. Chris has been able to pick up and run with everything Jane started, and he's already within this organisation significantly won his spurs. Alison Bussey, our Chief Nurse. Alison decided she wanted to go to, some would say, the other side of the fence, but in the brave new world, we're all on the same team. She went off to the integrated care system in Shropshire as their new Chief Nursing Officer. But again, I'm absolutely delighted that Liz Lockett, who was already an executive director in this organisation with the responsibility for quality, Liz has also taken on the Chief Nursing Officer role with great success, and I'm delighted to both of those individuals for joining us. Finally, if I may, I said already, we're going to encounter a very difficult winter. That will require our staff to work in heroic ways yet again. What we have established inside MPFT are psychological mechanisms for supporting our staff when they're stressed. And again, people like Kane Davidson, people like Dr. Lisa Whitehouse really now can identify and support staff. Staff, I think, feel comfortable to come forward and say, I do feel under pressure. Please, can you help me? Can you support me? And I think we have to find ways of helping our workforce. Are we entering very difficult industrial relations across the country? And will the health service, social care systems be part of that? I don't know. But I do know some of our staff are struggling to live at the moment. And the Trust is finding ways through hardship funds and other mechanisms of supporting those staff. But the point I want to make to members, it's not just the financial issue, it's the clinical, the pressures that staff find themselves under, both in wards and departments. But equally, you know, colleagues, it's also our support staff, our corporate staff, who support those staff who feel very stressed. And again, we have to find the ways, the right ways. What are we doing post-COVID as we begin to bring staff back to work, and how will that actually work? Happy to stop there, Jackie. I'm pleased.
Thank you. A wide range of areas covered. Any questions or comments for Neil from governors or members? Can't see any hands up. Okay. Thank you. Steve, you've got a question. You've got your hand up. Hi.
Hi. It's a question to Neil, Jackie, if I may. Hi, Neil.
Hi, Steve. Hello.
I just wondered in relation to the staffing issue, how dependent we are currently, and in terms of going forward, we might be on bank staff and the expense that goes with that.
Yes. And the answer is we are significantly dependent on bank, not so dependent on agency, Steve. But if we can't get permanent staff, if we can't get bank staff, we have to go to agency staff. And that's something we wouldn't want to do. So for me, we've got to find ways of recruiting people, giving them a living wage. An example is the NHS starts at band 1. No one's going to recruit anyone at band 1, and nor should we attempt to. So we've got to start at band 2, if that makes sense. But we've got to work as a system, and Alex Brett is intimate with this. It's no good us paying band 2, Steve, if others are paying band 3, depending what sort of jobs you're doing. So I think the easy answer is it is going to be difficult. It's something we monitor very closely. But I think as a board, we're clear quality takes precedence over finance.
Thank you.
Thank you. Thank you. I thought there was another hand up. Anne, did you have your hand up? Yes, Anne?
Yes, I did. Thank you. And thank you for your comprehensive report, Neil. It's one thing that's bothered me. I did a quality assurance visit a few months back, actually, on, I can't remember the name of the ward, but when we got there, it was cancelled. And you mentioned Manchester, which I found is absolutely appalling. And when we got there, this assurance visit was cancelled. But the reason being, there was a gentleman there that was being quite violent in the ward. There was an ambulance outside, and this guy was being put into this ambulance. I mean, he'd probably got terrible issues, but he was being sent to Essex. Now that bothered me, because I thought to myself, you talk about Manchester, if we're sending somebody from Essex from Stafford, well, how do we follow that up? Or, you know, is there a reason why? It really has concerned me ever since I did that visit. Thank you.
No, thank you, Councillor Regula. And I'm not cited on the issue. If you let me have a bit more detail, I can. But in exceptional circumstances, patients who have specific needs. So, for example, if that individual required regional secure facilities, just as an example, and we didn't have a bed, but there would have to be some very good explanation clinically why the patient would go out of area. It does happen, but if you let me have the details, I can follow up. And again, there have been times when staff have said no to visits, because you'll appreciate that can antagonize the behavior of an individual. And at the end of the day, it's not about protecting us from him, it's about us protecting him and trying to make the environment as stress-free as possible, Anne.
Yeah, thank you for that. I mean, I think that sorry, Chair, can I just come back and just say, what bothers me is how do we follow that visit up if we haven't got to send somebody? You know, do we make sure, you know, thinking about Manchester, thinking about the person out of Stafford. So that's the question, really. How do we, if it does happen, and why, and how do we control that and look after their needs?
And if I can be slightly cheeky, Councillor Regula, you have never been shy of picking the phone up and ringing me and saying, "Oi, what's happening?" But you know, there's a medical director and a chief nursing officer as well, and I'm sure they would be delighted to take a call from you, Anne, as I would.
Thank you.
Thank you. I'll take one last.
Sorry, and I extend, Jackie, that to any governor who sees anything or they don't understand it. You know, Abid and Liz will be intimate with it, and I'll try and bluff my way through.
Excellent, thank you. I'll just take one last question for this item. Alan, you've got your hand up.
Yes, please. First of all, a comment and then a question. So, just to comment on the stuff you talked about, CAMS, just as an extra layer of sort of reassurance. As the Children and Families Ambassador for the Trust, I have regular meetings with Claire and Debbie, and I can truly say that the CAMS and the Autism Service are very much high on the agenda. So I'm just as again, not that you didn't know, but just as an extra layer of reassurance.
Thank you, Alan.
The other thing is, in terms of support for staff, which I think is really important, you mentioned both the psychological and sort of the financial help. I remember a while ago when we talked about mileage, you talked about actually the trust would actually go alone a little bit and provide the extra support until the government stepped in.
Yes.
As far as I'm aware, the government still hasn't stepped in. So can you reassure us that support will continue?
Yes, that we have not discussed it since we increased the allowances. I don't know if Alex is on the line. I can't remember how much, but it was a significant amount. And Kane's here. And until we get resolution of that, Alan, we will continue for the foreseeable future. We're also trying to look at where an individual's base is. Please don't hold me to this at the moment, but I think it goes beyond the financial recompense. It depends where your base is, where you're traveling to, etc. So there's a lot in the ether being looked at, but Kane, the Deputy Director of Workforce, can give you an effective answer.
Well, you go. I think you've covered it, Neil. I think I was just going to confirm our commitment that we went out to say we would continue with that support until we heard a national position.
Thank you.
Thank you. That's really good to hear. Thank you.
Thank you. Okay, can I just ask Fiona, the lead governor, to present her perspectives in terms of looking back and looking forward? Thank you, Fiona.
Thank you. Two exceptionally difficult acts to follow. What can I say? So looking back, I was very privileged to be elected as lead governor last year. I think all of the governors appreciate the openness and honesty that is apparent from the trust. We invited to all of the community groups, the strategic direction, performance assurance groups and such like, and we're always given really good information from Steve Grange's team. And all the information that's fed to us is exceptionally relevant. I'd just like to reiterate the comment that I made in the chat earlier on. I think the huge success of the Trust in terms of the awards that people have received, that is really something to be proud about, something to shout about, and I do think it's a privilege to be part of the Trust. So I would just like to extend my thanks to that. And I guess from my sort of moving forward, I'll reiterate the statements that I've said, and it's published in all of the governor updates. My Teams is always open, as it were, because we're not quite in the open door policy yet, but we're getting there. I'm really excited to hear that we've got some of our previous governors come back on board. I think you mentioned Ravi and also, Leslie. So that's really quite exciting. So yeah, I look forward to continuing to working with yourself, Jackie, and the rest of the team, and also all of the governors. It's been quite an interesting year. I've had one-to-ones with quite a few of the governors over the last sort of 12 months, and I think we've got really quite a good crop of governors who are certainly interested in the Trust and are making a difference. You've got Alan, who's just mentioned that he's involved as an ambassador. I think we've got one or two other ambassadors that have expressed an interest. So yeah, I'm looking forward to the next 12 months and working with the team, and thank you.
Thank you, Fiona. Really, really positive comments. I just wondered if there are any comments or questions for Fiona. We've now got Chris Sands, who's going to take us through the annual report and accounts as well. And again, also Liz Lockett will follow in terms of the Chief Nurse Director Equality Report. So welcome, Chris, again, to take us through that.
Thank you, Jackie. I'm just putting a presentation up which I can take the meeting through. So can you see that okay, Jackie?
Yes, perfect.
Great. So this section is just to take everybody through the annual report, the annual accounts, and Liz will take us through the quality report. Just linking back to the earlier presentation by the external auditors. So what they've done as part of their work is to review what's within the annual report, and they look at the remuneration report in quite a lot of detail to make sure the figures are correct. And then they look at the rest of the annual report to make sure it's consistent with what they find from the audit work that they've done with us, but also that it's complete in terms of it includes all the things that statutorily we should include within there. And then in terms of the financial accounts, they check to make sure that the figures represent what we call a true and fair view of the financial position. So that should provide assurance that both the annual report and the financial accounts are robust and can be relied on. So just in terms of the annual report, there are three sections to the annual report. There's the performance report, the accountability report, and then the financial accounts. I'll just quickly go through all three. Now, Jackie and Neil will have already picked up some of the highlights, so I'll go through these quite quickly. But there is a prescribed format that we follow. So the performance report picks up the mission, the values and behaviours that we aspire to as an organisation. It also includes information about the services that we provide, and you'll be aware that we've got 4 care groups across the organisation, and within the detail of the annual report you'll see the breadth of services that we do provide that Simon mentioned earlier, but also the different localities that we provide those services within. So that's a useful checklist, I think, in terms of those services. And then we move on to how we manage risk within the organisation, and we use something called the Board Assurance Framework, and that really frames how we manage our strategic risks and how we focus our assurance through our board committees and through the board, but also how we plan and how we set our priorities and monitor those priorities through the year. There's also a section in there on equality, diversity and inclusion, and you'll see in there the good work that's gone on during the year, how the staff equality networks have developed and how the Trust gets assurance through the Equality and Inclusion Assurance Group. And then there's a section in there on sustainability, and we've just through the board agreed our green plan for 2022 to 25, and that starts to set out some of the plans we've got to make sure that we're more sustainable going forward. In terms of the accountability report, this picks up areas like the Care Quality Commission rating. So our organisation, we're rated as good. Now, we've not had a full review in year, but we've certainly had visits from the CQC who have been reviewing our services throughout the year. There's also reference to the system oversight framework. So this is something that NHS Improvement and NHS England assigned to organisations. We're assigned as a 2. The maximum autonomy for organisations is a 1. So it's a strong position to be in, but there's still areas for improvement there. The document also includes more about our approach to involvement, consultation and listening to views of service users, and Liz may pick up on that later in the quality report. And then there are some statutory areas that we pick up. So there's the remuneration report, which sets out the remuneration policy for senior managers. There's the outcome of the staff survey, and we were really pleased this year that we got a 59% response rate for our staff survey, and we performed really well compared to the benchmarks around all areas within that staff survey. Then we have the membership report, which sets out the work of the Council of Governors over the last 12 months and sets out our membership strategy and the work that's been done over the last 12 months. And then finally, there's the annual governance statement, which sets out the system of internal control and is a key document that the auditors rely on when they are looking at the financial statements. So moving on now to the financial statements, just picking up some of the key metrics then in the account. So our turnover for 21-22 was 543 million. So if you put that into context, that we spend in the region of about £1.5 million per day within our organisation. So a real contributor to the economies that we provide services to in terms of the people that we employ, but also the services that we contract with other organisations. We have fixed assets to a value of around just over 130 million. We've got a strong balance sheet, so strong cash in the bank of 145 million. And we've got some long-term borrowing, which we took out when we built the Redwood Centre in Shropshire, and also related to the PFI building at Haywood in Stoke. In terms of financial performance for 21-22, we had a very successful year, and a big thank you to all our staff, because we can't deliver good financial results without staff making sure they use all of the resources in the best way possible. So big thank you to everyone who's contributed to that, to all our budget managers. So we achieved a small surplus of 700,000, which was slightly ahead of our plan of a £500,000 surplus. We invested just over £11 million in our estate, and we stayed within our capital resource limit, which is a limit on the amount of capital spend that we can do in year. Even though we were in a difficult year with all the issues we'd got around COVID, we were still able to deliver efficiencies, and those efficiencies were above the national target of 1.1%, which was 5.7 million. So we delivered 6.8 million recurrently full year effect and 10.8 million of efficiencies in year. Now, we were supported by additional income related to the pandemic, which was sizable. So we got additional 36.5 million of income that came into the organisation to support us around providing additional services, providing the vaccination programme, to support around some of the direct impact of COVID, such as higher sickness levels. But that money only came into the organisation on a one-off basis. And then just coming back to what Tony presented earlier, Really pleased to get an unqualified opinion on the financial accounts, and no issues being raised on from a value for money perspective. So a clean audit, which is really good to hear. And then finally, in terms of looking forward, you only need to read the papers or watch the news to see that the financial outlook in the economy is becoming more challenging. We are seeing increases in inflationary costs, which is starting to impact on the services that we provide. So we do think the outlook going to the end of 22-23 and going into 23-24 is going to become more challenging for the NHS as a whole, and therefore for the systems we operate in and for the trust. The good news, though, in 22-23, we are ahead of our plan at month 5, and we are forecasting that we'll meet our financial duties this year, and we'll be in here again in a year's time to check whether we actually did that, but we're in a good place as at month 5. Although we are moving towards more collaboration in the NHS, we are seeing a continuation in terms of market opportunities. So there are a number of tenders that we are interested in, and we continue to expand our services by winning tenders, which again is good news, because we've got some real expertise in some of the areas where we're going out to tender. So this is areas like prison healthcare, and so we are doing really well in that area, and we'll continue to look at opportunities there. And we're also looking at opportunities around bringing additional funding into the organisation to help us develop our estate strategy. I mentioned before that we've got a capital resource limit, which does limit the amount of capital that we can spend. So we have to apply for additional funds, normally from national funds, through sending business cases. So that's something that we're doing currently with the Hayward Hospital, and we're looking at other opportunities to do that as well. And then finally, we are always looking at how we spend our money and making sure we spend that money in the best way possible. Very conscious that this is taxpayers' money, and we have to make sure we secure value for money in everything that we do. So we get the best bang for whether it's the Staffordshire pound, whether it's the Shropshire pound, or the pound that we spend for commissioners in other areas across the country. And that's me. So just commending to you the annual report and the financial accounts, and then Liz will just give an update around the quality account.
Thank you, Chris. Thank you. We'll take any questions together at the end if that's helpful. Okay, welcome, Liz.
Thank you, Jackie. I'm obviously Liz Lockett. I'm the Chief Nurse, Director of Quality and Professional Leadership. And firstly, I just wanted to say that I am proud and privileged to have taken on the role of Chief Nurse back in June this year, particularly as I started my NHS career over 30 years ago as what was then called a nursing assistant, and have really seen nursing both from the bottom right to the top of the tree. But I also wanted to take the opportunity to mention professional leadership, because alongside the chief nursing role, I also have accountability for our allied health professionals and our psychological workforce, and they are very key, important members of our team here at NHS services at MPFT, and we couldn't do the role without them. One of the disadvantages of going towards the end of the agenda is most of what you were going to say has already been picked up by my colleagues. So if you're not somebody that likes to talk, that's a good thing. But for me, I just wanted to maybe just reiterate some of the key things that we've heard so far. So the quality accounts is a really important way for us as an NHS provider to report to the public on the quality of the services we provide, both those things that we're proud of, but also those things that we've strived hard to improve throughout the year. in saying that, the format and to a large extent the content of the accounts are driven by the NHS annual reporting manual and of course the NHS quality accounts regulations, which was set back in 2010. So they drive us to look back at quality over the year that's just happened, but also to look forward and set some key priorities for the year ahead. In previous years, the accounts have gone through review with our external auditors, but during the pandemic, that responsibility to have that review was stood down. Having said that, we have still shared our accounts widely with our stakeholders, and we have encouraged them to look at the accounts and to comment on whether they feel they are an accurate reflection of the quality of services we provide at MPFT. And our document obviously holds that feedback that we've had from some of those key stakeholders. As in previous years, the accounts are in 3 parts. We have a statement on quality from Neil as our Chief Executive. We set out our priorities and quality improvement statements and standards and assurances from the board in part 2 of our accounts. And we also there feedback on the 3 indicators we set ourselves for that year, but also then talk about the 3 particular key indicators that we want to achieve in this year that we're in now. And then in part 3 of the document, we've got a number of other local indicators and nationally mandated indicators. What I wanted to say that as a trust, we've had to reprioritise to enable us to meet the demands that we've seen during the pandemic. And therefore, whilst we've done really well and achieved a number of our indicators, there are some that weren't at the place that we wanted to be. So our commitment is to continue to work on those indicators and to feed back to you again at this point next year to show you how we've done against those set of indicators. So just in terms of the 3 key indicators, we looked at particularly how we improve our reporting of medication-related incidents and near misses. And we have improved on that process, which has enabled us not only to learn from those incidents, but to reduce the likelihood of those incidents occurring in our services into the future. We also particularly looked at supporting patients to manage healthy weight in our adult secure settings. And as you'll see, we've been really successful in supporting those individuals to lose weight through a number of interventions. And then our 3rd indicator was about improving patient experience and feedback response rates. What I would say is while we have improved the number of response rates, we've got more work to do in this area, particularly about digital technology and how we improve the process and system by which service users can reach out to us and give us their feedback. That is an absolute priority for this year, and it is very much supported by our digital strategy. Just a couple of other issues I wanted to pick up on. We've mentioned the COVID pandemic, and we're still very much in the COVID pandemic, and we do keep seeing peaks and troughs in terms of those people coming into our services who are COVID positive, but also in our workforce that are trying hard to support our service users. I'm really proud of what we've achieved of an organisation, both in terms of supporting our service users through the pandemic, but also the key role that we've played in terms of those vaccination clinics and also in our research team in terms of some of those vaccination trials. We continue to strive to improve quality improvement, and 40% of our workforce are now trained in quality improvement techniques and methodologies and are deploying those on a day-to-day basis. I've mentioned digital technology, and we've got obviously our digital strategy, but digital technologies are key to quality and safety in our organisation. And my directorate and my professional colleagues are really working hard to support that digital strategy so that we get those right digital interventions to our service users and our carers. We mentioned service user and carer feedback, but I also wanted to take the opportunity to particularly thank our non-executive directors and our governors who have continued to support us throughout this last year around our quality and safety agenda. Your role in those quality standard visits is really vitally important to us, and you've adapted both to do that virtually as well as doing that physically face to face. So I thank you for that, because it really does help us to learn around those areas we need to improve, but also to celebrate those things we're doing well. I think I'll leave it there, Jackie, but I'm happy alongside Chris to pick up any questions that people would have around the quality accounts.
Thank you, Liz. Thank you, much appreciated. Are there any comments or questions for Liz and also for Chris? I can see Steve, you've got your hand up.
Yes, thank you. It's one for Chris, actually. I mean, you mentioned the PFI in Stoke, Chris, and I wondered to what extent that's a financial millstone for us.
So PFIs generally are more expensive than traditional capital builds. So there's been a lot in the media around the cost of PFIs. I think for us, it's a relatively small PFI. So it's part of the wider one with the local hospital. And I think it's about 10% of that. And from a financial perspective, we've got the budget for it. We live within the resource that we've got. So I don't think it's a millstone around our neck, and proportionately it's probably quite small in terms of our turnover. Where they can become a major issue is when it's a brand new hospital, and then it is a significant part of turnover. But I'm not overly concerned from an MPFT perspective.
Okay, thank you.
Okay, thank you. Are there any further questions for Chris or for Liz? Can't see any hands up. Okay. Okay, just to thank you both for your reports, which have been commended to the annual meeting and for the Council of Governors. So thank you both. Some really important issues raised, so thank you. Okay, so I just wanted to, in terms of questions and answer session, if we could invite any questions from public governors, members or staff. So this is just general questions or broader questions. Okay. Okay, Steve, you've got your hand up again. Yeah. Hi.
Sorry. I just wondered, in light of the virtual meetings that we're having now, when that's likely to end, and we're actually going to come together and stare each other in the eyes, as it were. Particularly the chief executive, of course.
Neil, did you want to take that?
Thanks, Jackie. Steve, for me, tomorrow, if that's possible, I think what we've got to do is work it through, just be clear where the infection rates are. But I think you raise a useful issue. The soonest we can get back, and my sense is a number of us should be holding face-to-face meetings now, because the reality is, Steve, I think we're losing something as a consequence of all of our business being conducted on Teams.
Absolutely. Thank you.
Okay. Okay. Any further questions or comments? Can't see any hands. Looking down the list, I can't see any hands. So given that there are no other questions, I'll just move on to any other business. I haven't been notified of any other business or any other queries or issues. So with that, I'm happy to close the Council of Governors and annual members meeting now. Can I just remind members who are here that there is a remunerations committee, that so if you could all remain after the meeting is closed for that remunerations committee, which I believe that Pauline Gibson is going to lead. So thank you all. Thank you.